This is the new pocketed drape central line dressing kit. There is also a pocketed drape pick kit. The difference between the two is the pick has the stat lock and the measuring tape. Art lines will also use the CVC central line dressing kit. Make sure that you grab the right kit for the type of dressing change that you will be performing. You open the kit, and on your first layer, you will have everything to remove the dressing. Start by washing your hands and applying the first set of sterile gloves. After applying the first set of sterile gloves, you will use the Detach-All, which is an adhesive remover. Please remember to remove the dressing low and slow. Pull the dressing back onto itself. You do not want to pull up, as that will contribute to skin irritation. Low and slow, removing the dressing back onto itself. On this layer, there will be also additional alcohol wipes that will be in this pocket if there's any bloody drainage and or adhesive on the catheter tubings that need to be removed. Once you've done cleaning the dressing and removing any adhesive or dried blood, you'll use the antiseptic gel hand wash and wash your hands. Remove the sterile gloves from the kit before starting to do the clean part of the dressing change. On the first layer, there is tape. The purpose of putting the tape on this layer is if you need it to secure the catheter tubings, if it's a PICC, or you can use it at the end of the dressing to secure the IV tubings, or if you need to secure any part of your dressing. So I've removed the sterile gloves. I'm getting ready to do the next set to clean the dressing. In order to flip the kit over, you can slip your hands into the pocket and flip it like that. Or you can grab the edges and flip it over. Then it will bring the clean part of the dressing supplies. The first, use the 3 alcohol wipes. That will remove any Detach-All residue or skin and oils. You have your CHG ChloraPrep stick. You want to scrub using small back and forth motions, approximately 3 to 4 inches out from the dressing. Make sure to go on your catheter tubing as well as lift your tubing and go under as well for 30 seconds. If the area is a groin line or an axilla line, those are considered moist environments, and you need to do your chlorhexidine scrub for 2 minutes. As you move from each skin prep, make sure that you allow the skin to dry for the appropriate amount of time. It can be up to 2 to 3 minutes using the CHG scrub. Your final step will be using your no sting barrier, which you want to apply starting 2 centimeters from the insertion site. Just swipe out anywhere where the adhesive from the dressing will touch the skin. Make sure you allow all skin preps to dry. If you don't and you move to the next step, it will contribute to skin irritation and the dressing changes. Your last step, you will be getting the BioPatch, which you want to apply blue side up, blue to the sky. You want the catheter to sit on the radial slits of the BioPatch. The catheter should go over that. That facilitates easy removal. Also, it will facilitate that the BioPatch has 360-degree contact with the skin, thus lessening your risk of infection. Lastly, you apply the dressing. Do not stretch the dressing as you put it on. You want to kind of fold it, plop it, and drop it. Okay? Smooth out using your hands as warmth to help the adhesive adhere to the skin. Your final step will be taking the securement bottom of the dressing and applying it snugly under the catheter pigtails. The tape documentation strip will go over this notched keyhole that will be left, which will close off the dressing entirely. Please make sure you date, you initial the documentation strip, as well as we would like for you to add the external length if the catheter is a PICC line. You also need to document the external length in the electronic medical record and compare it to the insertion medical record length. It should be no more than 2 centimeters difference. If it is greater than 2 centimeters, you need to problem solve that the PICC potentially has been pulled out. So this is our new pocketed drape dressing kit. Please give your VAD champion feedback. We have already changed the sequence of the steps from the original production. We hope you like it. We have some great supplies, the detach-all, the no-sting barrier, and this wonderful securement dressing. We hope will allow better skin contact and lessen our risk of bloodstream infections. Thank you.